This is episode 136 of the Death to Tyrants podcast. Let me tell you about one of my favorite sponsors, and that is Lucky Guy Bakery. Over at luckyguybakery.com, if really delicious, all-natural, handmade brownies sound like something you'd be into, well, this is the place for you. We're coming up on the holiday season, and I know a lot of you guys won't be traveling as much, probably as you did last year. Well, the brownies and treats over at Lucky Guy Bakery are the perfect gift idea. They come in really well-designed, handmade packaging, and each order has a handwritten note, which is a really nice personal touch that they do there at Lucky Guy Bakery. I could obviously go on and on about the flavors and tastes of the brownies. The new peanut butter bonanza bar is the most amazing peanut butter cookie bar that you will ever have. That is my Death to Tyrants guarantee. For those of you wondering if they have, something for your vegan or gluten-free friends, of course they do. Such a cool bakery. Handmade items, all-natural brownies, no preservatives ever. So many good flavors, such great packaging, such cool gift ideas, and they love this show. Let's give them some business. So go over to luckyguybakery.com and enter promo code DTTP at checkout for 20% off your order. It's an excellent product. They're great people. Their customer service is unparalleled. So go give them some support. Let's get to the show.
The crushing weight of the tyrant's passage had left nothing unmarked.
You get split in fucking half, but I call him the hologram wrath. But I am the center inside the placenta of math. You clash with cyanide gas and die fast. Rhythmical equivalent of solids, liquid, and gas. We smash your sinus with the power of Lord Titus. But I am the virus inside of the iris of Cyrus.
What is up, you guys? Welcome back once again to the Death to Tyrants podcast. As always, I am your host and humble narrator, Buck Johnson, coming to you out of Lockhart, Texas. And, there's apparently still some bad reporting going on about COVID-19. And I say that, I mentioned this in this interview. A lot of us in our little world here have found the appropriate outlets and the places to get our news from, especially when it comes to real facts and statistics behind and about COVID-19. And I think it helps, a lot of people have had it at this point. And so the fear-mongering doesn't work on a lot of us, but then you break outside of this bubble and it's still there. And there's still bad reporting on it. There's still people freaking out. There's still states locking down. And so I reached out to my guest today, reached out to him once again. This is his third appearance on the show. And if download numbers tell you anything, he is one of the most popular guests that I've had on. That's not why I'm having him back, just because I want the downloads to spike, to use some COVID reporting terms. But, I start sensing this crazy fear surrounding COVID-19 once again. And I needed to have Joshua Ketter back on. He also wrote a piece, and it's been a couple of months since he wrote it. And I failed on getting him on when he first put it out. So he's going to talk about it today. The last piece is the top 5 misleading COVID reports. And so there's still so much news on COVID-19, and we're going to break down some red flags to watch for when you see certain stats reported in a misleading manner. And then we're going to get into the actual statistics and which ones are important and where we're at with all of this right now in December 2020. And so I guess I'll just get Josh right on here because this is a fun conversation. In my own opinion, it is the best of the 3 conversations we've had. He gets into lockdown effectiveness or lack thereof, which, we've done on this show, but he's actually crunched the numbers, done a lot of studying, research on this. Same with masks. We haven't done as much on this show with the masks. And you guys probably won't be surprised what Josh found in him, studying the data, but maybe some of your friends would. And then we get into bad headlines and red flags on what to watch for. What terms do corporate news companies like to use to scare you or to deliberately misrepresent things? We get into all of that, and then what to look for in good reporting. And we get into some outlets that he thinks are actually very effective at presenting the news and statistics on COVID-19. So let's get to Josh. Josh Ketter is a retired data and analytics executive, say that 5 times fast, who spent a decade leading planning and analysis teams at companies like Amazon.com. He used to build complex models and prepare analysis for meetings with Jeff Bezos and was the primary analytics leader advising the chief digital officer and chief strategy officer at Target. We are very lucky to have him back once again on the show. Josh Ketter, how are you, sir? Welcome back to the show.
Hey, Buck, doing well. Thanks for having me. I apologize in advance for my raspy voice. I came down with pneumonia, apparently. Not COVID, although I'm sure they counted it as such, but you know.
Yeah, I've noticed the flu count, the quote-unquote case count, is quite low all of a sudden this year.
Yeah, it's gone down almost 50% for where it normally is at this time of year. Kind of crazy how that works, huh? COVID's up, flu's down.
Interesting. Yeah, of course they're going to say, well, it's the masks. That's why. Let me figure out the best direction possible to steer this, because in the bubble that I'm in, I honestly don't see much hysteria regarding COVID anymore. And then I will see some comments on someone else's thread. I think I've even seen some comments on some of your threads, and you see some of the kind of hysteria. Oh my God, how could you say this? And then it hits me like, okay, people are still freaking out. There still is bad reporting all over the place. And I guess maybe I'm fortunate that I surround myself with the better reporting on it. But
Yeah.
I guess that gets to my first question. Out of all of the stuff you see, read, hear, study, analyze, what percentage of COVID coverage that the mainstream media will say presents, what percentage of it is accurate and factual and well done?
Yeah, well, I haven't quantified it. I probably should. But just kind of my subjective view, probably every 9 out of 10 articles that I look at or headlines that I see when I check are factually wrong. So I'd say maybe only about 10% is truly, accurate.
Yeah.
Pretty low.
I figured it was something like that. So sometimes I don't know, I go back and forth. Sometimes I don't blame so many people for being freaked out. I one morning put on, as a Sunday morning news show, Beat the Press. And I watched like 10 minutes of it. And I said, no wonder everyone's freaked out. I mean, they are presenting this like the atom bomb's about to hit.
Yeah.
And it's crazy. And when you do know the reality of it, it's like putting those shades on in the movie They Live. You can kind of see what's really going on. And with that, of course, when I do see the crazy reporting, something that still gets me, and I thought we were past this, but we're not. Let me ask you, I'll ask it this way. Should we be alarmed when the media tells us of new cases? Are cases an important way to assess where things are with COVID-19?
Yeah, no. So the simple answer is no. Cases, and I'll maybe rephrase, if we tested the same everywhere, like if we tested, 1 million people a day in the same locations, random sampled them, then, cases over time would be a useful metric, right? But the problem is that we don't. And so, back in March, during our peak of the pandemic, we were, testing maybe 50,000 tests a day. We're now testing over 2.5 million tests a day, which is crazy. So you can't compare the number of cases today to the number of cases then. I mean, if you rescaled it, we would have had 300,000 cases earlier in 2020, and so we're still well under that. But because of that testing volume, it muddies the water. The other thing that muddies the water about cases is not just the testing being up 2,600%, but the way in which we test and the way we count in our labs. So specifically, like if you're in Europe, they basically amplify these PCR tests. About 32 cycles is roughly what they run. And in the US, some of our labs, and it varies based off lab, some of them are running up to 38 or 39 cycles. And if you actually looked at whether or not it was able to detect COVID after amplifying it up to 32 times, if we ran with Europe standards, we'd have almost 70% of our cases would be gone. So some of it's in how you count what's considered a case technically in the lab. A lot of scientists are arguing that the extra 6 cycles you're running, which is a big deal, is amplifying such minuscule amounts of DNA or RNA that it's not even meaningful, meaning the subject may not have been even infected. Like, you have so little material that they're multiplying that you shouldn't even be considered infected. Like, they may have picked it up in the air as they're pulling out, the test kit to swab you. They may have picked it up on your skin exterior. It may not have been in your body and actually infected your cells and made it past your first level of biological defense. So, to call that an infection is I think very, very misleading. So you've got that issue, this technicality of how we're measuring it. Then you've got the testing, the fact that testing is up 2,600%. And then you've got other issues, which is the data of how it's being reported. And specifically, there's 2 aspects. One is we've got 2 types of tests. We've got the PCR, which is supposed to detect if you're infected, right, which we just talked about. And then they've got antibody tests, which is, were you infected in the past, maybe 6 months ago, 9 months ago, could have been a month ago, whatever, but have you developed antibodies? Well, they're combining those 2 types of tests together into what they're now calling cases. Well, that's not an active or current case. It's an old case. So that's problem number 3, we'll call it. And then problem number 4 is they're taking, tests that they ran maybe a month ago or a few weeks ago, and they're reporting it today. They're uploading it to the database today. So when we're looking at the number of cases on any given day, that's not truly the number of cases that we had or infections on that day. That's the number of cases that they uploaded or batched into their database on that day, which is stupid. You should be using the date that you collected that sample, the date that you tested the person. And we're able to do that. We're able to report that way, but they don't. And so for those, I'll call it 4 or 5 reasons, cases is really useless. The thing that we should care about is infections. How many people are actually infected? And, for anybody who knows even basic levels of statistics, the way that you detect a population that you can't test 100% of, it's not feasible for us to run 330 million tests every day in the US, right? To test every single person in the US. It's not feasible. So basic level statistics, go run a random sample, right? And now you can extrapolate. Well, we're not doing random samples. We're going into hospitals and we're testing sick people. And we're screening with, thermometers. We're looking for their temperatures first to try and identify even further who should get the test. And so we're getting better at finding sick people. That doesn't mean that we have more sick people. And that is, and we may or may not. And in this case, certainly, I truly believe we do have more sick people today than we did 2 weeks ago or 4 weeks ago. But we're inflating it even more with the way we're going about this. It's a useless metric. So that's my longer answer is, short answer, the answer is no. Longer answer is hell no.
And within that, I just thought of another thing that I see that's obviously, because of what you just said, a fallacy, and that's look at the U.S. compared to Europe. Look how much worse it is. And the difference in the testing alone would negate you're not going to extrapolate any useful information just by comparing numbers then, correct?
Absolutely. That's exactly right. It's not comparable because of how we're counting it. You're comparing an apple to an orange. The one thing that you can use to compare across countries or regions, and this is what I focus on when I'm looking at what's really happening, is I look at excess deaths, right? And it's like you can mess up cases, you can mess up hospitalizations, you can even mess up what you call COVID deaths. But what you can't, it's much harder to fudge, is the total number of people who've got a death certificate at any given period of time. So excess deaths, the CDC tracks like, hey, we know about 8,000 people die a day in the United States. So if we suddenly have 9,000 people die a day, and this is a pretty stable metric. So if it starts to go up meaningfully or down meaningfully, something has fundamentally changed. And so we can look at that and see, okay, well, how much are we being impacted by this? And when you look at us versus Europe, we are a little bit worse, but it's not as bad as our reporting indicates. In fact, to give you an example, right now, our excess deaths in the U.S., based off of what the CDC is reporting, is about 10% higher. So instead of 8,000 deaths, a day, we're experiencing 8,800. Well, that extra 800 deaths, I think it's fair to probably say there's a portion of that is, lockdown deaths, like people are having excess suicide, deaths, and despair. And there's a large portion of that's also COVID, because those are the 2 fundamental changes that we've had. So even if you attribute all of it, though, for argument's sake, to COVID, right? You say, okay, we're having about 800 deaths a day. Look at the media's report right now. What are they reporting? Like 3,000, 3,500 deaths a day, something stupid. That's divorced from reality. That's actually not possible. And if you were to believe that, then what you'd have to believe is that suddenly 30% of our normal deaths, like cancer and other stuff, has just gone away, which that's not believable, right? So there's ways to kind of strip out all of this bad reporting, bad cases, bad fatality attributions, and I think that's one of the easiest ways to look at how disconnected as we are. Is we probably have about 800 or less deaths per day right now from COVID per the CDC's own reporting, but they're reporting 2,500, 3,000, 3,500. We're very off right now.
What other buzzwords do you see in reporting that would raise a red flag when it comes to news on COVID-19?
Oh, record, new record,
Okay.
or surging. I swear, like almost every time I look into that, it's bull. And for a few reasons is records that they've been reporting right now are based off date of report. So they'll say most people died ever. And then, the really inaccurate ones will say in the last 24 hours. Like, well, no, we actually don't really know how many people have died in the last 24 hours because it takes a few weeks to get reporting on that. What we do know is how many fatalities they uploaded into a database today. And by the way, some of those are because public health officials are going back and looking even back to last March and April for things that meet potentially the criteria or look like it could be COVID, and they're recategorizing them as COVID and then uploading them into the database today. So, that's usually the one that I see, to give your audience an example, a clear example. I'm sure they've upped it to maybe 3,000 fatalities in one of these recent days, but I was seeing reported 2,500 fatalities or more a day. But when I actually look at, we've got CDC deaths based off date of death as of like a couple of weeks ago. So there's a few weeks lag. So if I go back 2 weeks, it was under 1,000, right? At the time they were reporting this. So you're talking about a difference of, if you look at the actual date people are dying and the true trend of like what's happening today, about 1,000, and they're reporting 2,500. I mean, that's a crazy multiplier above just because of the way they're capturing data and uploading it to the system. And, to be fair, deaths have gone up a lot in the last 30 days, and we are getting close to where we were back in, previous March and April. So I don't want to undersell it. Like, there's really stuff going on. But, the way they report, usually when they say there's a record, there's not actually a record. It was worse before. You just wouldn't know it based off the way they talk about it.
Right. What's up, guys? I would like to tell you about a wonderful small company that reached out to me to sponsor this show because they love the content. That company is Paloma, Verde, CBD, and Organics. It is owned by two great people, Carlos and Vanessa Abalar, in my old town of San Antonio. They are libertarians, and honestly, the COVID lockdown was a bit of a blow to their brick and mortar location. But Carlos has assured me they are tough and will soldier on with business from people like my listeners. That is you guys. They will power on. I trust that for sure. Go check out their website at palomaverdestore.com, where you can find things like their amazing melatonin CBD gummies if you'd like to sleep a little bit better. You can find the sports cream if you've got achy muscles. I know you guys work out constantly. And they've even got CBD skin salve. Of course, they have the CBD extract tinctures for daily use. They have gummies for all occasions, including strictly vegan ones, if that is your thing. You guys know the great anti-inflammatory benefits of CBD. And by the way, all of their products over at Paloma Verde are THC-free. They've even got the studies on their website to show exactly that. And so check this out. I told you they're great people. They want to support my show. Here's what they're going to do for you guys. When you use promo code BUCK, B-U-C-K, you will get 25% off of any purchase over $75. You will also get 10% off of your first purchase when you sign up for their emails. So add that up. 25% plus 10% will give you a total of 35% off of your first purchase. You want to support a small libertarian-owned business and support my show at the same time and get a great product that you will love? Go to palomaverdestore.com and use promo code BUCK, B-U-C-K. That is palomaverdestore.com, promo code BUCK. So for my listener that's, flooded with media about this stuff and they understand, okay, case, it's dumb. The word surge, okay, try to write this off. What are a few things that you would see terminology wise or data point wise that you would say, okay, this person or this news report or this outlet, they probably know a little bit of what they're talking about?
Yeah, I mean, I think fatality rates, and fatality not as a rate of cases, but fatality as a rate of estimated infections. And that's not a number you can report on every single day because it requires studies. But at this point, we've got enough studies, several prevalent studies that they've done that when I see an outlet reporting, here's our estimated infection fatality rate, they'll call it IFR. I think that's usually a news resource, even if I disagree with them maybe on how they calculated it. That's going to tend to be more accurate and more representative of what's happening from a fatality risk perspective. The second one that I look for that's more real time is hospitalizations, right? And there's some issues with that too, but it's more accurate than cases, and it's a good baseline to understand. And so if I see somebody reporting on hospitalizations, but in context, meaning they're telling me, okay, we have X number of COVID admissions, today, let's say it was 100, and they can tell me like, is that better or worse than what it was during the previous peak, or earlier, this year, mid-year, maybe when there was a lull, depending on what region you're in. Then that's somebody who's painting it in context, and that's helpful. And the piece that I don't see done a lot, but every now and then on hospitalizations, is people rarely put it in context in terms of what's driving, any hospital capacity issues. Meaning, we've had 1.4 million healthcare workers laid off during the pandemic, right? Back in April and May. And so we've not regained all of those. In fact, that shortage created a crunch. People are getting burnt out. There was real COVID, so that's also burning people out. I mean, there's multiple factors that have created the fact that we have less staffing. So when I see headlines that say, COVID is the issue, I mean, it is a issue, but is it the issue? I don't think so. There's actually bigger issues at play. So when I see newspapers or any media institutions report more in context and say, hey, here's our hospital capacity, it's either good or bad compared to prior years. That's another piece of context that I see missing. Yeah. It's helpful to know that, hey, the flu just 2 years ago, states were overrun. They were treating people in tents. We're not actually there yet. We're actually better off than we have been in the past. We're not where we probably should be, but it would be nice if we hadn't lost all those healthcare jobs. And, so those are the types of facts that when I see those mentioned, I get a little more confidence in who I'm listening to. If they don't give me that context or even talk about it, then to me, that's a flag that maybe they're just looking for headlines.
Yeah. Is Houston one of the places where there was a hospitalization capacity issue in the last month or two?
No, I mean, as a whole, no. I mean, I'm sure there's been one or two hospitals, right? Capacity issues usually materialize on the hospital level, but as a whole, no. We're actually about 75% below where we were previously. And again, this is where, if you don't use data and you don't compare time periods, you create false narratives. And so most people, even on my Facebook page, who read some of the things I post, didn't know that. And they're sitting here arguing with me like, no, I talked to ICU nurses in Houston and, this is the worst it's ever been, right now, like in the last few weeks. And I go pull the data and I'm like, oh, how can that be? We used to have, 2,500 people in the ICU and now we've got like 700. So like, that's way less, and same thing for general beds, Houston and Texas in general experienced our peaks in July and August. Early August. So we've come down off that significantly. I mean, almost 2/3 less people in the hospital today due to COVID than were before. So if we have any hospital issues, it's not COVID that's the issue. I mean, maybe people held off on procedures. They held off on real medical issues. It's also cold season. Maybe something's going around that's not COVID too. I mean, there's a lot of other things out there that'll drive hospitalizations. So whenever I see singular focus on COVID, that's a flag for me.
Yes.
It needs to be put in context.
Yes. One of the fallacies that you wrote about in your most recent piece was the false scale, cumulative versus growth. Can you explain that?
Oh, yeah. So, I mean, especially the early graphs you'd see on COVID, they're just stacking them, right? So if I had 1,000, fatalities the day before and another 1,500. They just keep adding them and they're showing the cumulative number. Like, now we're up to 300,000. So if you show any graph going from like 0 to 300,000, it's going to look really, really high. What it's not going to show you is what's happening today, right? And I think that's what people should really care about when you're thinking about, okay, well, where are we in the life cycle? Is it better or worse? And so you want to look at graphs of change, like incrementally, how much did it change from yesterday to today, right? What's my 7-day average growth of something? And using that same example, if you go from 0 to 300,000 deaths, but then the next month you have 1 death a day, well, if I show you that same chart going from 0 to 3,000 plus, 7 deaths, it's still going to look just as scary. It's this vertical chart, but you're going to miss the fact that, most of that's in the past, right? Most of that's already happened. If I look at what's happened today, it's pretty much gone. And so that's why we have to look at things on a growth basis to understand what's happening today. And unfortunately, you don't see as much of reporting on that as I'd like. And in the early stages, it was blatant. People were using these graphs, I'd say, to lie. I mean, it's a classic example of how to lie with statistics if you want to create an impression that we're going off a cliff. We may or may not be, but if you don't look at growth rates, you can't truly know what's happening today.
Yeah, and I want to know if you run into this because there is a lot of statistical data put out there that, like you said, is probably just put out almost as a lie if you really know what you're doing. But you'll hear people say, well, so if those are lying, well, how do I trust your stats guy? Or how do I know which stats, there seems to be truth over here, but then they say it's a lie. How do I know where the truth is? There's so many outlets reporting so many things. What advice do you have for people that have that frustration?
No, this is a very valid frustration. I think the key is to go to the raw data, right? Because usually the ways people lie are within how they present it, right? The scales that they choose, whether they graph it cumulatively or on a growth basis. So go to the raw source of the data. Number one, like CDC, for all of the grief I give them, they've made some very poor decisions and they've not done the best job. But, at the end of the day, they are gathering data. And so there is unbiased data there that you can just pull and look at and formulate your own opinions. And while it's not probably sexy to a lot of people who don't like math or numbers might scare them, you do have to learn some basic level statistics and not deep statistics, just like the basic things I just talked about, like whether you're looking at a cumulative graph or a change-based graph. You got to do a little bit of research and educate yourself on how to look at numbers and which way of looking at it is going to answer the question that you're asking. And so it takes a little bit of work. If you don't trust anybody.
Right.
Find somebody that you trust who's been right. And, that's where I look at, there's people who report numbers like accountants, and then there's people who will forecast numbers, right, and make projections and predictions. So I look to scientists who've made projections and predictions in the past that's documented out there. And then if they've been right or close to right, I tend to listen to what they're saying when they're interpreting numbers more than the people who've said, yeah, we're going to have 2 million deaths in the next, year. And we haven't, right? So that's one way you could probably pick somebody to listen to if you're having trouble deciphering it for yourself.
Talk about another thing you wrote about, and that was the growth rates, the error of omission. And you see this a lot. It'll say the percentage of growth over the last, month or several months. Explain the little trick that's used when they present that in such a misleading manner.
Yeah, when I was a CFO, one of the things that I would always ask whenever I got percentages is I wanted to see the X and the Y, right? So I want to see the raw numbers because there's a big difference between going from, 1 widget to 10 widgets, which by the way is like 1,000% growth, right? So somebody says, hey, I got 1,000% growth, but okay, great. You used to make $1 a day, now you made $10 a day. But if we're talking about going from, 100,000 widgets to 1 million widgets, like that's a very different, it's the same growth rate, but it's a very different implication. And so you really have to understand the raw numbers in context. And so whenever I'm given a growth rate that sounds high or scary, usually it's off small numbers. It's very easy to hit high growth rates at small numbers, but that just, that doesn't mean as much. Like I might invest in an Amazon who's growing, 20% a year, as opposed to a small mom and pop shop who's growing 1,000% a year, right? And, maybe making $10,000. So that's where I think it matters. The one that I think I highlighted in my article was hospitalizations, and I think it was Louisiana or something like that.
Arkansas.
Oh, Arkansas. Thank you. So they reported something like, I think it was like 187
They reported 74% increase in the hospitalizations after Memorial Day weekend, which, sounds scary. I mean, that's almost 100%. And I'm not saying that's not something to monitor like you should, but the piece that was missing from the article is the actual X and Y. It was like going from 107 in the hospital to like 187.
Yeah.
Well, I came from a small town of like just a few hundred people. So that might sound scary to some of your listeners. But you have to put it in context that Arkansas has a population of 3 million and they have 9,000 hospital beds. So like an extra 80 beds out of 9,000 is just a bunch of nothing. You got to watch it to make sure it doesn't turn into a 1,000, getting used. But like, the implications from just giving the percentage and not giving the context, I think is misleading.
Yeah, I'm trying to remember back. Was Memorial Day weekend in Arkansas where there were pictures out in the media world of people partying, a bunch of young college people partying in a certain area? I cannot remember specifically.
You may be right. I don't remember either. But, there have been a lot of that. Like you show an image and then you show a high percent.
Right.
And create a perception.
Right.
But, which may or may not meet reality. But if you don't give the context for people to judge for themselves, right, whether it's a big deal or whether it's just a big percentage on a small number, you're doing a disservice,
Yes, I remember seeing that photo, and I have friends online that were posting it. Oh my God, look what's going. These people are crazy. Don't they know what's going on? And then it is interesting to, after that gets out there and makes the rounds, you see an ABC News article from Arkansas and discusses the 74% increase over Memorial Day weekend. Your quote in it, or the article, one official in the state told ABC News some hospitals there are nervous. It's like, it's just so ambiguous. Yeah, one official in the state. It's like, what if one said, no, everything's cool? It's just interesting, the ones they report.
They probably wouldn't have been quoted then.
Of course not, yeah. And they'll never identify themselves either, I've noticed. But I want to talk about graphs and something that you call the false comparison. What does that mean, and how is it seen typically in reporting?
Yeah, so I think the false comparison is usually about manipulating scales, right? So it's kind of creating the impression, like in the idea with lying with statistics in this technique is you want one thing to be going, up, and you want another thing to be going down. You want to create some visual separation so that your audience walks away with the impression that like one thing is clearly good and the other thing is clearly bad. And there's ways you can manipulate in order to do that. And you may be comparing an apple and an orange is the other thing too, right? So there's ways to do what I'll call true false comparisons. But I think the one that I was specifically referencing was, and I think it was like in Kansas or something like that, somebody, I think in a health department or related to the health department, that came out with this graph because they wanted to prove that masks work, right? So they showed two things. They showed certain counties' performance on a number of cases per population, which again, cases, major issues, but we'll assume that it's okay for right now for sake of this conversation. So they said, here's the number of cases per 100,000 people, for the ones that are required to wear masks, have mask mandates, and then here's a graph of the ones that don't require to wear masks, right? And it showed, again, going to the visual representation that, no mask mandate was kind of flat. And then wherever they required masks, it was going down. So clearly mask mandates work. Well, what they failed to disclose, and you have to be somewhat astute to see this, is they actually used two different scales. And they put, one scale on the no mask mandate counties and another scale on the other. And if you put them on the same scale, the same graph, which they should have done, you'd see that actually counties that didn't have mask mandates had less cases per capita the whole time. And they just stayed flat. Like there was just no change. The ones that did have mask mandates were just always higher. And they came down from like being 3 times as many cases per capita to like, maybe 2 times as many cases per capita. And I don't know, you'd have to ask the person why they chose to do what they did, but clearly they manipulated it to tell a story that actually wasn't true. Because if you graphed it the right way, you'd actually maybe draw the opposite conclusion, which is that, counties that don't mandate masks actually perform better. than the ones that do. And, I don't want to get into cause and effect versus correlation because, we can't say for sure, but that's a clear violation of ethics, I think.
You said this was nearing criminality. And when I hear you explain it and I'm looking at the graph, and again, I'll link to this page in the show notes page for this episode, it's insane. And I don't know that I would have realized this without hearing you or reading your piece on it, because on the left, it starts at 25 in the scale they're using, and on the right, it starts at 14.
Yeah. Literally, the high end of no mask candidates doesn't even fit on the scale of the mask mandated counties because it is performing so much better, you might say, like less infections, or less cases per capita. And so they literally altered the scales, put them on. It's almost like putting on two separate graphs, and then tightening it and getting rid of, you get rid of 0, right, on the graph. You get rid of anything that can create, same scale, and you manipulate it to show something. It's just like you're skewing it. It's almost like drawing a new line.
Yeah, that is incredible and unfortunate that they're doing this stuff. I want to read a headline that you pulled when you wrote your piece because it's going to sound very familiar to a lot of people listening. And if you don't learn how to look past just the headlines, people are going to say, oh my God, we're doomed. And this headline reads, "New coronavirus cases in the U.S. soar to highest single-day total." Explain why, in context with what was actually reported in the article accompanying that headline, that's misleading.
Yeah, so the first thing is, I believe this is the Washington Post, and technically, I think their headline was accurate in the sense that day, all of the reporting institutions had uploaded to a database the most number of positive cases for that single day, right? But where it misses the boat completely is it creates the impression that, oh, wow, so coronavirus is, higher today than it was back in March or April, right, at its previous peak, which is not true. And the reason why is they're leaving out testing. What they should have said is, testing levels soar to the highest single day ever. We've tested the most people we've ever tested today. Oh, and we got the most cases that we've ever got today, which you would expect. So they left out testing. And in fact, I think at that point, they had done about 1 million tests in a day. And if you go back to March or April, we were doing 50,000 tests a day, or it was 10,000. I think at the early level, it was 10,000 tests a day. So you're looking at this massive increase in tests, and really cases follow testing pretty well. There's some variation with case positivity rate, right, which is a better indication of what's actually happening. Caveats to cases still apply. I think it's all bullshit, but I'm going to talk about it from the perspective of lying with statistics. Is you can't leave out the fact that you just increased your testing by 2,600%. No shit, your cases are the highest they've ever been. Your testing's the highest it's ever been. So I think if a media institution was actually trying to report this accurately, and this is how corporate America would do it, by the way, because you have to run a business and you have to make real decisions based off real data. You can't just, drum up headlines and make choices that way. That's stupid. There'll be real consequences. So in a corporate America, if I had something that changed my driver by 2,600%, I would go adjust that back to my prior period to say, well, what if I had done a similar amount of volume, in this case, testing? What if I tested 1 million people, back in March? Well, you would have uncovered over 200,000 cases. So the fact that we just uncovered 50,000 cases, at 1 million tests is really not that scary. It's actually less than really where we were before. So maybe a simple way of summarizing is it was misleading because we didn't actually have more cases than we've ever had.
Right.
We had still maybe half as many cases as we would have had if we had tested them all back in March. So that's where I say I call bullshit on Washington Post headline. I just don't think it's ethical to make those statements without providing context.
Right. It'd be akin to reporting a massive increase in vehicle accidents and not realizing, well, this test was done at 5 p.m. on a Friday and our first test was done at 3 a.m. on a Sunday. And it's well, naturally, there's more cars on the road, so of course you're going to get more wrecks. But when you leave out this one important fact, it just sounds like, well, what the hell's going on? This is crazy. Yeah, it's mind blowing. And like I said, I'm always in this bubble. I guess I surround myself with like people I trust and reporting I trust. And then you kind of jump outside it for a second. You're like, oh boy, yeah, people are freaking out again.
Yeah. I mean, and it's not hard to do. Like they could have literally, I mean, because other people have done it. I ran them. And the math's not hard. It's just take however many tests you did today, assume you did the same number of tests during prior days, run it all the way back, X number of months, multiply it by the positivity rate you got back then. And you can I mean, it's not perfect, right? I mean, it doesn't always scale linearly, but you can roughly estimate how many, cases you would have had if you had kept your testing the same. And, other people have done that graph, and the graphic would look very different than what they presented. I mean, it would have shown a clear decline with the small second wave, and then it was declining again. And this is in the middle of them reporting it, right? Like, truly infections were down. If you looked at it as an epidemiologist, you would have concluded infections in the United States were declining that day. Meanwhile, the headline would have you believe it's worse than it's ever been.
Yeah. I want to ask, and maybe you've not researched this, so I actually don't know. Have you studied any data on the effectiveness of masks or not, maybe that they aren't effective?
Yeah, no, I have. I've looked at it pretty intently as I was trying to forecast how the pandemic might shift with mask mandates or not without mask mandates. And I mean, I guess you didn't ask the second part, but I can just profit what I found, which is you have to understand a few different things. So whenever I talk about masks, I put them into two categories, right? Which is one, do masks filter things, right? Do they filter particles and of different sizes, whether it's 0.3 microns or 3 microns, whatever? Do they filter things at different size levels? And then part two is, do masks actually prevent infections or not? Do they prevent it from spreading? And people confuse those two. So the data that I found clearly showed, masks, depending on what mask you're talking about, right? Whether it's N95 or cotton or whatever, they are pretty effective at filtering a certain percentage of particles. It can be as low as 20% of some smaller particles, all the way up to 99%, 99.9% of particles. So yes, masks do filter things. But when you actually look at randomly controlled trials for respiratory viruses, to see whether or not if you put 100 people in a room and they're all wearing masks, are they going to spread the same? And the CDC published this. I'm glad they published this on their site before the coronavirus ever hit, because we know it's not biased by politics. But the CDC published, they did a meta review of all of the randomly controlled studies on this, because there's very few outside of a hospital setting where it's sterile, right? Sterile use of high-end masks in medical grade and hospital settings. But they did a few studies, and I think it was roughly 12 randomly controlled studies. It's the gold standard for usage of masks outside of hospital settings. And what they found is half the studies showed a small improvement and half the studies actually showed it was worse. Meaning, even if they can filter out particles, whether or not you're touching your face more and therefore infecting yourself, or whether it creates a humid environment, which actually helps the virus to spread and actually more easily to infect you, or whether it makes you more careless and you get more, you're less afraid to go up and be close to somebody, right, and not socially distance, it may have negative effects that actually cause greater rates of infection, depending on how things are being used. So that's why randomly controlled trials matter, because you can see all these other variables that you cannot study when you're just looking at, do particles go through a mask, yes or no? And so that was their conclusion, is that literally they do not work in mass usage with either medical grade surgical masks or normal everyday cotton masks. So that's what I found. I also found the same thing from I think he's considered one of our top 2 national experts on PPE, meaning masks and respiratory viruses in America. And he came out, as some guy at University of Minnesota said, same thing. He's look, I'll wear one, but let's not pretend that this is going to do much. It's just not. That's what the science shows. And same thing in the data, right? Now we have a bunch of data. You can compare, same example I just gave on the counties in Kansas. Look at, you can look at the mask mandate timelines in LA. After they mandated the masks, they actually had greater levels of cases. You've got other places where they didn't mandate masks and they've gone down. So when you look at masks relative to whether it's cases, hospitalizations, fatalities, there's just no correlation unless you start looking at Asia. And scientists are starting to think there's something else going on in Asia. It's not masks, because some places in the US and Europe are actually wearing masks to the same or greater levels than Asia, and we're not seeing a change. It's why you see 80-90% of the people who come in test positive for COVID actually say they're avid mask wearers.
Right.
It's just not, I know it's kind of a sacrosanct topic and highly emotionally charged for people, but like the science shouldn't be. The science is what it is. The only place, I saw like a study that the World Health Organization did early on with COVID, and it was more COVID specific, right? I mean, COVID is similar size, a little bit smaller than influenza in terms of virus particle. So most of these randomly controlled studies I mentioned are like influenza or rhinoviruses, other, respiratory viruses. So they should be helpful for us to make conclusions about COVID, but they're not randomly controlled studies on COVID. But the closest one to it was like they did all the skip tracing, and testing and following and documenting of cases of COVID early on in China and through Europe. And the World Health Organization noted like, okay, were you wearing masks when you were around people? Were you not? And they kind of went through and tried to do like a multivariate test where they looked at all the variables they could, run it through a machine, basically like a software machine, and figure out what variables made the most difference in terms of whether or not you passed it on to somebody else or whether you got it or not. And that study, they tried to estimate, which I think is the best thing, because oftentimes we put it into binary, like, did it work or did it not, right? Do masks work or don't they? Well, maybe it's not that simple. It's like, do they work 5% effective or are they 90% effective, right? We should maybe quantify things a little bit better versus just saying either good or bad. And so I liked this study because they did that. And they estimated, based off all the testing they had done and all the case studies, was maybe around a 10% benefit to wearing masks. So I'm kind of the mind of everything I've looked at, that masks are probably negligible. In some cases, if you do it wrong, it may be worse. In some cases, if you do it really well, you're a trained professional, it may be very beneficial. But on average, best case, maybe in mass, the current way we're doing things might have a 10% benefit. So it's, you're way better off social distancing, cleaning your hands, keeping a healthy immune system. Like if you think through the things we should be focused on as a society, science and data would say it's a bunch of other things before masks. So the obsession over it, to me, is just kind of ludicrous, virtue signaling. Let's do something that, is visible.
Yeah. It's interesting also because it might feel good, but if you could just look into some data, like you mentioned, and you really do care about all of this stuff, you're not doing yourself or anyone any favors by pushing the mandates for masks and all of that. You mentioned something quickly there, and it's something I've heard recently, that they're thinking something else is going on in Asia. What is that?
Yeah, we don't know. It could be their diet, right? They might. It could be genetic. Yeah, you've got everything on the spectrum from. And there was a study actually that talked about this, which is, and I think it came out a while ago, so it's been out for a while, which basically they looked at and they said, hey, we believe from other testing that another coronavirus spread through Asia a few years ago, or in the last 10 years, right? And that mass spread through Asia of this other coronavirus gave some cross level of immunity, meaning when this coronavirus came out, COVID-19 or SARS-CoV-2, the folks in Asia as a whole were more immune. Their immune systems recognized it as a cousin of whatever they had before, and therefore were less susceptible. So I think that's one, leading claim. On the other spectrum, if you go to like conspiracy theories, right, is, which may or may not be true, but like if you accept the idea that this could have been engineered in China, as a biological weapon potentially, then it would be not illogical to conclude that it may have been designed for, Western Europe to have a greater impact based off genetic profiles than those in, Asia. So, you've kind of got that spectrum, and there could be things in between that we don't yet understand. Everything from diet to culture, how they interact. But,
sure.
As a whole, scientists generally are agreeing, like, it's not masks that separates Asia from, because there's some Asian countries that don't wear a lot of masks. And even if you follow the time period in Japan, where certain places were wearing masks all the time, and then there's a time period where they weren't wearing them at all, hardly. And if you look at compliance levels, the data doesn't change dramatically. So again, that's why they're like, okay, it's not masks, it's got to be something else. Here's some hypotheses.
And to go back quickly to the studies that you had kind of gone through on masking versus not masking, did you say initially the ones you saw were for the flu specifically, the early ones? I guess that's because that's all they were doing. Okay.
Just because they're randomly controlled trials, right, which is the gold standard. I mean, you can have like observational studies or meta-analysis where people kind of do different studies, with different methods. But if you don't do, double-blind, placebo-controlled, studies, that doesn't meet the gold standard for scientific evidence. You could have confounding, variables, even the researchers influeing the outcomes. So that's why I say those ones that I found from the CDC, they were published, I want to say like in January or February of this year. Those, and granted, those studies were from before. So these are studies that have been done over the last 10, 15 years, well before we even knew of COVID-19. And they were done on influenza and rhinoviruses and other respiratory viruses to kind of see, do masks matter or not? It was actually funny because they looked not just masks, it was masks, other PPE like face masks, and even washing your hands. And they found that like almost none of them didn't make a material difference at all. And so, again, you have to assume that, if that's true of general respiratory viruses like influenza and rhinoviruses, which are a coronavirus family, then like it would probably apply to COVID-19 too. So that's kind of the extrapolation, which I think is fair.
Yep, sure. And I asked because what I assume is going to be kind of a trial run for mandatory COVID vaccines. A friend of mine works for a company, and they have now mandated that everyone gets a flu vaccine. Of course, in Texas, at least, we've got this exemption form you can fill out that's a religious-based deal. Yep. And they said, you're allowed to fill out that form and exempt yourself from our mandatory flu vaccine. But if you do that, you have to wear a mask at work until May 1st. And my initial thought is, well, that's just punishment, of course. Yep. But it's interesting to hear you go over those charts. And now, obviously, it is punishment because there is no studies that show that that's going to do anything for anyone.
Yeah.
Especially with the flu.
Yeah, no, I agree. The mask hysteria is wild. I mean, the only piece to masks that like I'll throw out there, and again, this is a hypothetical because again, it's not randomly controlled, placebo-controlled tested, is that masks, because we know they filter things, right? I mean, they do filter, right? So it's going to reduce, in theory, should reduce the amount, the viral load that you're exposed to. And if you have a lower viral load, you may still get infected at the same rate, right? Which is what the studies show, but it may not be as severe because you've been exposed to less. So there may be a benefit to it, an ancillary benefit, but that's a hypothetical that's not actually been tested in a randomly controlled way for mass populations. So I think those are studies that I'd be fascinated to follow and see. I don't blame anybody for wearing one because even if it has a 10% benefit and you're high risk, like do that, great. But the idea of mandating it and talking about it like a cure, if we all mask up, it'll be gone in 2 weeks. Well, how many weeks has it been since they said that? I mean, right. It's freaking crazy.
Yes. I want to tell you guys about a great sponsor of the Death to Tyrants podcast, and that is our friends over at Zippix Toothpicks. These are flavored toothpicks. They've got several great flavors. Check these out: cinnamon, clove, mocha, and whiskey even. But not only that, each toothpick actually contains nicotine, and I use these toothpicks all of the time. Not only are they a great alternative to that nasty habit you may be trying to stop, and that includes vaping, come on now, but they taste great. They are way more socially acceptable. They are cheaper than any alternative. Hell, I don't even dip or smoke or anything like that, and I still love these Zippix toothpicks. Out of all the alternatives on the market, these are the most cost-effective, and better yet, they are a sponsor of this show. When a small business is out there helping to support one of your favorite Liberty podcasts like this one, let's thank them by returning the support. Since you are a loyal listener to the Death to Tyrants podcast, you will get 10% off of your order by entering promo code DTTP at checkout when you order over at zippixtoothpicks.com. Once again, go to zippixtoothpicks.com. That's ZIPPIX toothpicks.com and type in promo code DTTP for Death to Tyrants podcast at checkout, and you will get 10% off of your order, and you will be supporting Zippix and Death to Tyrants at the same time. So go do it. Let's get back to the show. Do you still get some negative pushback on your pieces, or has the tide turned where people are kind of, maybe it's not what I initially thought all of this was. I'm not so scared, and Josh's pieces make sense?
That's a good question. I don't know. I don't get as much negative commentary. That's for sure. It could be that I just outlasted them. I wore them out with kind of rebuttals and data, right? But I think it's a mixed bag. It's hard to gauge. I like to do things from a data perspective and make sure it's representative. So I don't know. Is the short answer. That I'd hope that the tide has turned a little bit, and more so just people understanding what they're hearing and being able to formulate their own opinions, whatever those may be. I just, my biggest fear and concern at the beginning of why I even wrote anything was I was just concerned people were just regurgitating what they were hearing and accepting it as truth without actually thinking.
All right. And the other hot topic with COVID, of course, is the lockdowns. And I've done a lot of episodes because I'm of the mindset that the lockdowns do far, far, far more harm than good. Have you studied that aspect of all of this?
Very much. In fact, that's probably one of the ones I've spent the most time on. And the data supports your position, by the way. It's very clear that lockdowns kill people.
Yeah.
And, lockdowns is a broad spectrum of things. I think it can be an abused term in the same way cases can. But at the end of the day, even the CDC published a study that said, about 1/3 of excess deaths, right? Which right now we have like about 350,000 excess deaths in the U.S. Are actually not COVID. They're other factors. They're deaths of despair. We'll call them deaths of despair, suicide, and depression, right? And that's what I call lockdown deaths. Really anything related to the idea of fear, anxiety, policies, the lockdown policies that run people's businesses out. They don't have any income. They can't eat. There's malnourishment. There's, physical, mental, emotional stress that leads to, suicides are way, way, way up. It's crazy how high they are.
Yeah.
But those aren't the only thing, if you got cancer and you decide to just stop taking your pills and you don't want to go in because you're afraid of catching COVID and now you die of cancer, those are some of the deaths that we're seeing. We're seeing excess deaths elsewhere. And the sad part is these, we'll call them just call them 100,000 roughly. They're a little over 100,000. So these roughly a little over 100,000 lockdown deaths, if you look at the age of them, right? We know COVID skews more towards like 80-year-old, I think is the average age of fatality, or maybe it's 70 something, but it's fairly high. It's like 70s, 80s. If you look at these deaths of despair and suicide or lockdown deaths, most of these are younger people. In fact, the highest demographic impacted is between ages 20 and 30. So these are people with another 40, 70 years left to live. And so when you go take out 100,000 people who've got that many more years left to live, the life years lost, societal production, the number of years that people will be on this earth has actually far outweighed via lockdowns. Like the impact of it is far greater than the life years lost from COVID. And, and that's a story that doesn't get a lot of attention. You may see a study or two here referenced about it, but no, I think the data clearly shows that lockdowns kill. And that's why you see the Great Barrington, Declaration. You see a bunch of scientists, doctors and nurses and epidemiologists coming out and saying, hey, we have to stop this. We cannot continue to do what we're calling mass lockdowns. The way we're doing it is killing people. So let's not let the cure be worse than the disease.
Right. Which outlets have you come across that have the most honest reporting on all of this?
Probably Unheard. I think it's unheard.com.
Okay.
I think those are mostly some guys in Europe, but I like that they cover both perspectives of any topic, right? And that's what I look at for a little more unbiased coverage. And they've done a great job at kind of looking at especially COVID from multiple perspectives and bringing on experts to have debates. And they kind of stay out of making statements and they just kind of, present the facts. So I've really liked them. There is another news organization I probably need to visit more often. I think it's like a collation. So they've got hey, here's the news from the left, from the middle, and from the right. I always find places like that, like meta news organizations, can be really helpful. So I can follow up and send that to you later. But that's probably the two that I look at when I think of COVID.
Okay. I thought for sure you'd say CNN. So what do you think based on all of the stuff you've studied, what's the most effective way getting through all of this? Because we clearly don't believe it's everyone masking up and locking down in your basement for the next 2 years. What do you think?
Oh, what do I think is the best policy?
Yeah, if you had, I don't even like using the term public health policy, but I suppose if you were to pitch one, what would it be?
Well, I think Sweden's general strategy is the right strategy, if I'm honest. And I know they get a lot of flack for it. But just the idea of personal responsibility, and if I were in public health, you're also going to want to do whatever you can to support those personal choices. And so, in that regard, what I'd probably do is I'd invest a lot of money. Like I'd make sure every household in America has vitamin D, right? There's a reason why fatality rates in the summer were so low. You're getting vitamin D and you're getting out and you're in the sun. Respiratory viruses spread a lot more during the winter months. So I would make sure people have vitamin D. I'd make sure they're educated on their immune system, that people are encouraged to get sleep. You're encouraged to eat healthy diets and do the basic things. And so if we're going to go spend, what was it? Like in the US, we spent $100,000 per family roughly is what we added in national debt through this whole crisis, which is stupid. I would have probably given a lot of that directly to families to support those needs to keep them actually healthy. And then programs to encourage people to be outside. I wouldn't have told people to shelter in place. That was one of the stupidest things we could have done.
Yeah.
We should have said, everybody go outside, open your windows. This is actually what Japan and other places did. So I would have taken more policy recommendations that empowered people by educating them about which factors most reduced COVID transmission rates and most reduced fatality risks. I would have locked down the senior living facilities for sure, identified people who are high at risk. I would have shipped them not even N95s. I would have shipped them N99s, right? I would have moved all of the resources to those areas. I would have put UV lights at the entrances, would have put strong digital controls and accounting of who's coming in and out of those facilities, testing. I actually think one of the best things we've done is the thermometer testings to see, hey, does anybody have a fever, when you're going out? That actually is a great screening tool to identify potentially compromised folks. So I would have put that at all facilities, and how much of that needed to be government versus private money, I don't know, but I guarantee it would have been a fraction of the cost we did spend on a bunch of other stuff that doesn't seem to have really mattered. The PPE ramp ups, all those things are wise. I think those are applicable to anybody, but that would be my general strategy. Empower the public. They make their own decisions. We're not doing lockdowns. Try and keep businesses running, but keep people's bodies healthy so they can fight the infection. Do encourage social distancing. I do think that that's wise. Where appropriate, I wouldn't probably mandate it, but and then if you're sick, quarantine the sick and protect the vulnerable.
Yes,
those would be the general tenets.
Where are we, I guess, in all of this? Do you think? I mean, it's December as we record this, and we've been warned by one of the presidential candidates that we're in for a dark winter. Where are we with coronavirus, and where do you think we're headed in the next few months? I know there's a vaccine coming that could make it better, I suppose. Where are we with this?
Yeah, I mean, so right now, if we look at kind of, you can call it a 3-wave, but it really wasn't. Like we had our first wave hit the Northeast, and then it hit the South and Midwest in the middle of summer. So we kind of had our first wave that looked like an up, and then a middle hump, and now we're in our second wave. Through our normal respiratory season. And right now, if I look at fatalities from COVID, if I can trust the numbers that are coming in, it looks like we're up to about 1,500, maybe a little more fatalities per day. And so it's definitely climbing. Our previous peak at the very beginning was 2,500 a day. I think now that I'm seeing the current trend, I think we could get close to that. It could be almost as bad as it was at the very beginning. Granted, it'll be more spread out in the US. I think as you look at January, February, I do think it is going to be worse than it is today. Generally speaking, if you look at trend lines for respiratory viruses, like it's going to be 2 weeks will be worse probably than it is now. But I think we'll peak at some point in the next 30 to 60 days, and then it'll decline. And like most respiratory viruses, at that point it should largely go away, and call it like April, May. As the summer months start coming around and humidity levels rise again. And at that stage, we should have acquired a significant amount of immunity. The one advantage we have going into this respiratory season is we're probably somewhere between 15 and 20% of the U.S. has been infected. And so that gives us some good level of pre-existing immunity. Couple that with deploying, whether it's, I hope the vaccine is effective, but deploying that to the people who are most vulnerable, I think will make a big difference, assuming it's effective. So you add those two variables of, decent level of pre-existing immunity through prior infections, 15 to 20%, add in a vaccine. I hope that we won't quite hit the peak that we hit last year or earlier this year, but we could. I think it'll be worse in a few weeks than it is today. And then hopefully we'll start to subside after that. And then next year, we really shouldn't be talking about it. It should be done. I mean, that's how most pandemics work. They don't continue on for years and years.
Right. And something just popped in my mind before we get out of here. Is there a study being done, or have you seen numbers on repeat cases of it already?
Yeah, people are always talking to me about that. And yes. So yes and no. I've not seen a full long study. What I have seen is the documented cases of it, at least as of a month ago, was I think there's 4 or 5 in the entire world.
That's right. Okay.
Where they had actually documented. And keep in mind, I'm not talking about out of a certain number of cases. I'm talking about out of infections. The World Health Organization estimated over 10%, of the world population was infected. That's what, 700 million people. So if out of 700 million people infected, they've only documented 4 or 5 that were actually reinfected, it's so negligible that I can't believe they even talk about it as a major risk at this stage.
Well, excellent. Do you have any new pieces coming out that we should know about?
Oh man, I wish I'd planned on it. I might do one. So, one thing I'm actually going back to corporate. I just accepted a CFO role for a large company, and so I've gotten a little bit busier. My side job of writing is not probably as promising as it once was, but I may do one here in the next few weeks before I start.
Excellent. I hope so. Is there any place that my listeners can find you on social media?
They can log on to Twitter or that's pretty much it. I mean, you can find me on Facebook. I'm not super active on either at the moment, but
what's your Twitter handle?
Twitter handle is Sangfroid, Sangfroyd.
Got it. We will link to that in the show notes page, as well as this piece that we've been referencing this whole time. Josh Ketter, once again, man, this has been wonderful. Thanks for joining us.
Likewise. Thanks for having me, Buck. Always a pleasure.
See there, now you are armed with the actual facts that matter regarding COVID-19. Quit letting your friends abuse you online. I know a lot of my listeners wouldn't ever let that happen, but don't be afraid to, you're armed with your facts now. Shoot down all the negative, fear-mongering stuff that's out there. There's so much of it. And I'm glad Josh was here to help with that. Thank you so much, Josh. As for this show, we're nearing the holidays, and we're nearing some big changes coming up in January. You will still have my podcast in the feed that you get it now. Am I giving some more good hints as to what's going to happen? So if you subscribe to Death to Tyrants, you'll be fine. If you don't, you better go subscribe right now. You can leave a rating and a review. All of that part will be the same. The other things that are changing, we'll get to soon here in the next few weeks, because I got to tell you, obviously, before January comes, it's all good. I can tell you that. I'm not going away. Things are getting bigger and better, and we will leave it there. As for the show, of course, deathtotyrantspodcast.com. That gets you all of the links and all of the information you need on all of the past episodes. It's got my Facebook, Instagram, Twitter, the Patreon page for you guys if you want to become a Patreon donor. It's got all of that over at deathtotyrantspodcast.com. Visit our sponsors, and you guys have an excellent week.
You get split in fucking half, but I call him the hologram wrath. But I am the center inside the placenta of math. You clash with cyanide gas and die fast. Rhythmical equivalent of solids, liquid and gas. We smash your sinus with the power of Lord Titus. But I am the virus inside of the iris of Cyrus.
Like the sound of the Death to Tyrants podcast? Our audio production is provided by Podsworth Media. Check them out at podsworth.com.